Alright, so welcome to the next segment of these ECG videocasts. Today's case involves the ECG of a 50-year-old gentleman who presented to us with palpitations. Now, when you look at an ECG, don't be scared. Always try and form a general impression of the ECG. Remember that an ECG is all about curves, shapes, and morphology. And lastly, have a differential diagnosis for what you see. Now over here, we clearly have a narrow complex tachycardia that is regular. So this is a really nice table, and if you have a look at it, your tachycardia is divided into whether your tachycardia is narrow or wide, and whether your rhythm is regular or irregular. And each of these has three differential diagnoses. Right, so we are in this category now today. Sinus tachycardia will be a heart rate more than 90, and a P wave that is upright in 2 3 and AVF, and 1 P for every QRS complex. Alright, next we have your supraventricular tachycardias, and lastly your atrial flutter. Now, there's a couple of nuances with atrial flutter. The first thing is that when you're trying to form a general impression, right, you can characteristically see this typical sawtooth pattern. And if you ever look at lead to it, especially from far, you can kind of pick up a sawtooth pattern. The next thing to remember is that if you have a heart rate of 150 plus or minus 20, you must think atrial flutter with a 2-to-1 conduction. Now I'm going to show you a little trick to try and pick up the P waves. Just remember that the P waves are best seen in lead 2 and V1, and more specifically in V1, because V1 sits right over the SA node. But if you flip the ECG around, and if you have a look, you can actually spot the P waves. There's a P wave, and there's a P wave. In the QRS complex, P wave, and P wave. And you can see the 2-to-1 conduction. Alright.